Hello, health enthusiasts. We're diving into a fascinating comparison today. Today, we're setting our sights on the vast and diverse world of healthcare, specifically focusing on three distinct landscapes: Nigeria, the United Kingdom, and the United States. Each of these countries, with their unique features, strengths, and challenges, offers a rich tapestry of insights into how healthcare can be delivered and managed. From Nigeria's evolving health infrastructure to the UK's esteemed National Health Service and the multifaceted healthcare system of the United States, we'll delve into the nitty-gritty of what makes each system tick. We'll uncover the triumphs, the hurdles, and the nuances that define these health sectors, providing a comprehensive understanding of their inner workings. This is not just a comparison, it's a journey through diverse health landscapes, each with their unique stories and lessons. So buckle up as we embark on this exploration of diverse health landscapes. First on our list is the health sector in Nigeria. A vast and diverse nation, Nigeria's healthcare system is a reflection of its rich tapestry of cultures, economic conditions, and geographical disparities. It's a complex structure, broadly divided into the public and private sectors, with a mix of traditional and modern medical practices. The public health sector is further stratified into three levels: primary, secondary, and tertiary. The primary level is the first point of contact for most Nigerians, and it's where basic healthcare and preventive services are provided. Secondary healthcare facilities, often general hospitals, cater to more specialized services and handle cases referred from the primary level. Tertiary healthcare is provided by teaching hospitals and specialist clinics, offering advanced medical services and conducting medical research. It's vital to understand that Nigeria's health sector is primarily funded by the government, international donors, and out-of-pocket payments by patients. The government's contribution, channeled through the National Health Insurance Scheme and direct budgetary allocations, has been criticized for being insufficient. The out-of-pocket payments, unfortunately, account for a significant portion of the health expenditure, making healthcare inaccessible for many Nigerians, particularly those living in poverty. Now let's talk about the common health issues in Nigeria. The country grapples with a double burden of disease: communicable diseases like malaria, HIV/AIDS, and tuberculosis, and non-communicable diseases such as hypertension, diabetes, and cancer. Malaria remains a leading cause of morbidity and mortality, especially among children under 5 and pregnant women. The prevalence of non-communicable diseases is also increasing due to lifestyle changes and urbanization. On the bright side, Nigeria has made significant strides in reducing maternal and child mortality rates over the years, thanks to initiatives like the Midwife Service Scheme and the Saving 1 Million Lives program. The country has also successfully eradicated wild polio, a significant achievement celebrated worldwide. However, accessibility to healthcare remains a pressing issue. Many Nigerians, especially those in rural areas, lack access to quality healthcare services. There's a severe shortage of health facilities and healthcare professionals, coupled with the high cost of health services. Some Nigerians have to travel long distances to access healthcare, and even then, they may find the services unaffordable. To address these challenges, the government has embarked on a journey towards achieving universal health coverage, aiming to provide quality healthcare services to all Nigerians, regardless of their economic status. Efforts are being made to improve health infrastructure, increase funding, and strengthen the health workforce. The government is also encouraging private sector participation to complement its efforts. Moreover, digital health initiatives are gaining momentum in Nigeria. Telemedicine, electronic health records, and mobile health technologies are being leveraged to improve healthcare delivery, particularly in remote areas. These innovations hold great promise for the future of Nigeria's health sector. In conclusion, while the health sector in Nigeria has its share of challenges, from funding constraints to healthcare accessibility, it's important to recognize the efforts being made to improve the system. The road to a robust health sector may be long and arduous, but with concerted efforts from the government, private sector, and international community, Nigeria is making strides towards a healthier future. Despite its challenges, Nigeria's health sector is striving to improve and meet the health needs of its population. Moving across continents, let's examine the health sector in the United Kingdom. Situated in the heart of Europe, the United Kingdom boasts one of the most comprehensive healthcare systems in the world. This system is built on principles of universality and accessibility, ensuring that every individual, regardless of their circumstance, has access to quality healthcare. The backbone of the UK's health sector is the National Health Service, fondly known as the NHS. The NHS was established in the aftermath of the Second World War in 1948, with the aim of providing healthcare to all, free at the point of delivery. Today, it remains one of the world's largest publicly funded health services, serving more than 60 million people across England, Scotland, Wales, and Northern Ireland. Funding for the NHS comes primarily from general taxation, supplemented by national insurance contributions. This approach ensures that healthcare costs are spread evenly across society, with the wealthiest contributing more than those less fortunate. In the fiscal year 2023 to 2024, the NHS budget stood at over £130 billion, reflecting the UK government's commitment to maintaining a robust health sector. The UK's health sector faces a range of common health issues. These include non-communicable diseases like heart disease, stroke, cancer, and diabetes, which account for nearly 90% of all deaths in the country. Mental health issues are also a significant concern, with 1 in 4 adults experiencing at least one diagnosable mental health problem each year. The NHS provides a comprehensive range of services to address these issues, from preventative measures like screening and vaccination programs to treatment and rehabilitation services. Healthcare accessibility is a key strength of the UK's health sector. The principle of universality means that every resident in the UK has a right to access NHS services, regardless of their income or social status. This includes GP consultations, hospital treatments, and even some dental services. The NHS also offers a range of specialized services such as maternity care, child health services, and mental health support. Additionally, the NHS operates a 24-hour advice line, known as NHS 111, providing immediate access to medical advice and support. The NHS also plays a crucial role in medical research and innovation. The UK has been a leader in many areas of medical research, including genetics, stem cells, and public health. Many of these breakthroughs have been made possible through partnerships between the NHS, universities, and private sector organizations. This collaborative approach has led to numerous advancements in medical technology and treatments, benefiting not just the UK, but the global health community. Despite its strengths, the UK's health sector also faces challenges. These include increasing demand due to an aging population, workforce shortages, and the ongoing impact of the COVID-19 pandemic. However, with its commitment to universal healthcare, its robust infrastructure, and its culture of innovation, the UK's health sector is well positioned to meet these challenges head-on. In summary, the UK's health sector offers a unique blend of universality, accessibility, and innovation. Guided by the principles of the NHS, it ensures that everyone, regardless of their circumstances, has access to quality healthcare. Through its comprehensive range of services, its commitment to medical research, and its focus on equity, the UK's health sector plays a vital role in maintaining the well-being of the nation. The UK's health sector, led by the NHS, is a model of universal healthcare, providing free health services at the point of use. Finally, we hop across the pond to the United States. A nation known for its technological advancements, the USA has a unique approach to healthcare, with a complex system that interweaves public and private sectors. The American health sector is a tapestry of multiple entities, including private companies, government programs, and nonprofit organizations. While it may seem complicated, at its core, the system revolves around two major components: private and public insurance. Private insurance is the backbone of the American health sector, covering nearly 2/3 of the population. These plans are often provided by employers, but can also be purchased individually. They offer a wide range of coverage, including preventative care, hospital stays, and prescription medications. However, the cost and quality of these plans can vary significantly, leading to disparities in healthcare accessibility. On the other side of the coin, we have public insurance. This is provided by the government and primarily serves three groups: the elderly, low-income individuals, and people with certain disabilities. The two main public insurance programs are Medicare for the elderly and Medicaid for low-income individuals and families. These programs ensure that some of the most vulnerable populations have access to health care. Despite the broad coverage of private and public insurance, there are still millions of Americans who are uninsured. High costs and lack of access to affordable plans are the main barriers to insurance. This lack of coverage can lead to delayed or foregone care, resulting in poorer health outcomes. Beyond insurance, another key factor in the American health sector is the prevalence of chronic diseases. Conditions such as heart disease, cancer, and diabetes are among the leading causes of death and disability in the USA. The management of these diseases is a significant challenge, requiring ongoing treatment and lifestyle changes. The American health sector also grapples with health disparities. These are differences in health outcomes that are closely linked with social, economic, and environmental disadvantages. Factors such as race, socioeconomic status, and geographic location can influence an individual's health outcomes. Addressing these disparities is a crucial aspect of improving the overall health of the nation. The accessibility of healthcare in the USA is a multifaceted issue. It's not just about having insurance, it's also about having access to quality care. This includes having a regular source of care, being able to afford medications, and having access to preventative services. Although strides have been made in recent years, there is still much work to be done to ensure that all Americans have access to the care they need. Innovation is another hallmark of the American health sector. From cutting-edge medical research to the development of new treatments and technologies, the USA is a global leader in healthcare innovation. This drive for innovation not only improves patient care, but also contributes to the country's economic growth. The U.S. health sector, with its mix of private and public insurance, offers a unique approach to healthcare. While it has its challenges, such as high costs and health disparities, it also has its strengths, including a wide range of coverage options and a strong focus on innovation. Despite the complexities and controversies, the goal remains the same: to ensure that everyone has the opportunity to live a healthy life. Now that we've looked at each country, it's time to draw some comparisons. When we compare the health sectors of Nigeria, the UK, and the USA, we see distinct approaches to addressing health issues, each with its own set of strengths and weaknesses. Starting with Nigeria, we find a system struggling with funding and infrastructure. However, it's important to note the resilience of its health workers and the impressive strides it's making in improving health services, particularly in rural areas. The use of mobile health clinics and community health workers are innovative solutions that other countries might learn from. Turning next to the UK, we see a health sector that is widely recognized for its universal healthcare system, the National Health Service. The NHS, funded by taxpayers, ensures that medical care is available to all, regardless of their ability to pay. However, there's a downside. The system often experiences long waiting times and a lack of choice for patients, indicating a need for improvement in resource management. Across the Atlantic, we have the USA. The American health sector is marked by cutting-edge technology and world-class medical research, but these advancements often come with a hefty price tag, making healthcare unaffordable for many. The lack of a universal healthcare system means that access to quality health services is often determined by one's financial means. So what can we learn from these three countries? From Nigeria, we learn the importance of innovation in overcoming resource constraints. The UK's NHS shows us the value of universal healthcare, while also highlighting the need for efficient resource management. And from the USA, we learn that while technological advancements are crucial, they must be balanced with affordability and accessibility to ensure that everyone benefits. In conclusion, each health sector has its own unique approach to health issues, with varying degrees of success. It's clear that there's no one-size-fits-all solution to healthcare, and each country can learn from the others to improve their own systems. These three countries, each with their unique health sectors, offer valuable lessons in addressing health needs and challenges. Before we say goodbye, let's quickly recap the key points from our discussion. We explored the health sectors of Nigeria, the UK, and the USA, each with its distinct features. In Nigeria, we noted the challenges of inadequate infrastructure and staffing, but also the resilience and determination to improve. The UK, on the other hand, boasts of a robust national health service, offering universal healthcare, though it grapples with long waiting times and funding issues. Meanwhile, the USA's health sector, marked by cutting-edge technology and research, is also characterized by high costs and a significant uninsured population. These three nations, each with unique strengths and challenges, highlight the complexities of healthcare delivery worldwide. By understanding these systems, we can appreciate the global efforts towards achieving better health for all. Thank you for joining us on this journey through the health sectors of Nigeria, the UK, and the USA. Stay healthy and see you next time.